Huntington's disease is a genetic and ultimately fatal disease that induces a progressive destruction of neurons in the brain. As a result, it causes a deterioration in a person's physical, emotional, and cognitive abilities. In Australia, it is estimated that around 5 to 7 per 100,000 people are living with HD. However, there is evidence that there is an increasing prevalence of between 15 to 20% per decade. The worldwide prevalence of HD is estimated to be between 3 to 7 per 100,000 people, whereby the highest frequencies of the disease was predominantly found in European countries. Though individuals are born with the disease, symptoms arise in adults in their prime years between the ages of 30 to 50, or even younger. However, there is also a less common early onset of the disease, whereby it affects individuals of the ages of 20 or younger. This is called juvenile Huntington's disease. HD is an autosomal genetic disorder, which means an individual needs only one copy of the defective gene to develop the disease. Each generation generally presents an affected person. It is passed on from parent to child through a mutation in a gene. Therefore, when the parent has the defective gene, each child has a 50% chance of inheriting the gene that causes Huntington's disease. Huntington's disease was first documented in 1872 by George Huntington, who described the disease as hereditary. However, it was not until the conduction in modern research to discover the cause of the disease. In 1983, scientists finally located the gene associated with Huntington's disease and pinpointed that HD was caused by a mutation in a single gene. A gene called huntingtin, or HTT, is located on chromosome 4 and has been shown to provide neuroprotective function as well as enhance neurotrophic factors. It consists of 3 nucleotides, C, A, G in repetition, a pattern also known as trinucleotide repeat. This is normal for most people as they have between 10 to 35 repeats. However, the mutation, which causes the disease, occurs when there is an expanded number of repetitive sequences of the CAG bases, generally more than 36 times. The higher the number of repeats, the greater the risk of disease. People with 40 or more CAG repeats will develop HD in their lifetime. However, people with 35 to 39 repeats are associated with lower penetrance, which means they have a risk, but they may or may not develop the disease within their lifespan. The abnormal repeat leads to the formation of long proteins known as polyglutamine. Though the exact effect of excess polyglutamine on HD symptoms is not known, scientists have hypothesized that it inhibits proteasome activity, therefore leading to toxicity. Also, the mutant polyglutamine sequence aggregates within the neuronal cells in the brain, particularly in the basal ganglia, and damages the normal neuron functioning in many ways, including interfering with their transport networks and gene regulation. This is mainly affected in the dorsal striatum in the basal ganglia, causing apoptosis, which is neuronal cell death. Huntington's disease also leads to the expansion of the lateral ventricles, resulting in loss of nerve tissue. This is where the symptoms of HD can be observed. The symptoms of HD first show up as subtle changes in behavior and movement. It involves progressive CNS disturbances. Hence, the symptoms eventually develop into substantial physical, emotional, and cognitive issues. The physical symptoms include chorea, which are involuntary jerky movements affecting the fingers, feet, face, or the torso, poor coordination, slurred speech, and difficulty in eating and swallowing. The emotional symptoms include mood swings, anxiety, depression, and anger. Cognitive symptoms presented in HD include lack of judgment, difficulty in prioritizing and organizing tasks, as well as poor problem-solving and decision-making abilities. As the disease progresses, it is most likely to cause dementia. Health professionals conduct many tests to diagnose HD. A physical examination is first taken to observe the symptoms. The tests to determine the severity of the disease include neurological tests, genetic tests, and diagnostic imaging, such as MRI. Pre-symptomatic genetic testing can also be done for someone who has a family history of HD, but shows no symptoms. Undergoing this test is very personal and often a decision difficult to make. This is because finding out the result may bring powerful emotions. A negative result will bring about devastation and depression. Hence, counseling is recommended for pre- and post-test results. Unfortunately, Huntington's disease cannot be prevented or cured. Though there are medication available for HD, they are only to relieve symptoms and often have side effects. Other forms of medical assistance, such as physical therapy, occupational therapy, and speech therapy, are also available to manage physical inabilities. Constant research is being conducted to understand the mechanism of HD. The National Institute of Neurological Disorders and Stroke, NINDS, conducts and supports research as well as funds other clinicians and researchers to identify potential therapeutic strategies. Currently, stem cells are being heavily tested to potentially rebuild brain structures through transplantation. Gene slicing therapies are also undergoing clinical trials to reduce the level of toxic HTT protein being produced. This can slow the progression of the disease and not just manage the symptoms. A neuroprotective therapy that slows, stops, or prevents the disease is still the highest priority. Although it has not yet been established, the advances in research and technology is continually assisting in understanding the disease, as well as identifying the therapeutic targets for future investigation. With the recent use of animal models that closely represent the pathology of HD and ongoing clinical trials, there is great hope for the future in its progression and advancements.